Welcome to the risk analysis course. This is the second in the series. Today we are looking at risk analysis in public health and trade in food. I am your lecturer, Professor John Muma, Professor in Veterinary Public Health. First, I want us to look at the history of risk analysis. The first risk analysis paradigm for public health was proposed by the United States National Academy of Science, and it focused on assessing the risk of cancer from chemicals in food. So the decision process, remember that we mentioned in our earlier lecture that risk analysis is a tool that's used to make rational decisions. So in this instance, the decision process was divided into three major steps. That's conduct research, and then do risk assessment, and then undertake a risk management. In the National Academic of Science paradigm, the principal steps were considered to be sequential, with the decision process commencing with research and concluding with decision. However, such an approach does not recognize the possible influence of other sources of data or other influences on the data. Risk analysis process is influenced by other factors, such as political factors, social and economic factors. So why is risk analysis used to guide decision making? Why? Because risk analysis systematically addresses disease and food safety challenges, and also it is a formal and transparent conceptual approach and integrated form of looking at things to guide decision making. So it is conceptual and it's also integrated. So it has these elements in the sense that it gives you a logical sequence flow of activities, and also it's objective because it's based on science or scientific evidence. And also it has got the aspect of transparency because the decision made based on risk analysis are objective and based on scientific evidence. So risk analysis also may be used because nowadays most nations have incorporated the principles of risk analysis in the registration. So we may be obligated to apply risk analysis principle because the national laws or regulations dictate that we should use risk analysis in decision making. And also there are certain trade agreements that bind nations to apply risk analysis in trade, such as the WHO SPS agreement. So when you look at the structural framework of risk analysis, we mentioned in our earlier presentation that risk analysis is made of risk assessment, then you have got risk management, and then you have got risk communication. A risk analysis, I earlier said that it is a structured approach to assessing a problem and finding solution. So basically, risk analysis is informed by different type of data sources because you need information, and this information we talk about scientific evidence. So the data sources may come from various disciplines. So you may need epidemiological and toxicological data, you may need microbiological data, and data on human behavior, and also data on engineering. So you need different type of data to input into your risk assessment process. And also risk analysis is multidisciplinary in nature. In other words, you need different type of expertise to give in their knowledge and the skill in order to to estimate the right, to have a right estimation of the risk. And also, risk analysis is team driven. It's not something that is encouraged to do alone, but if we are to do a comprehensive and good work, it's better we do it as a team effort. Let me start by saying that before you undertake a risk analysis, you need to plan. So in the planning phase is basically about formulation of the problem. And this is very, very important if we are to achieve the highest quality result in the risk assessment process. So the planning phase basically is involved in formulating the problem. And we say that this is teamwork, and so every member of the team should be involved in the initial planning of a risk assessment. And they should be involved in formulating the research question that will be answered by the risk assessment. And also they should participate in determining the degree of acceptance of the uncertainty. I'll come back to talk about uncertainty later on, either in this lecture or in the subsequent lectures. So you realize that the two major outputs of a risk assessment are estimation of the likelihood of occurrence of an event and the magnitude of the consequences. But also we estimate the uncertainty associated with that result or probability estimate. I say that the planning phase should include discussions of criteria for the quality analysis, which will drive the data quality needs for the project. So what we are saying here is that what is the quality of analysis that you want to undertake? Will you be comfortable with just a rough estimate of the risk, or you want an accurate risk estimate? So if all you are interested in is a rough estimate of the risk, then such a project may have high degree of uncertainty, may be acceptable. So high degree of uncertainty may be acceptable if all you're interested in is estimating, having a rough estimate of the risk. But if you are interested in having a more accurate estimate of the risk, then you need to have high quality data. And we'll later on discuss what is the difference between low quality data and high quality data. And we are saying that the models that you use or the method of data analysis need to be more robust so that we can achieve high certainty with respect to the output of the risk assessment undertaking. The risk assessment phase should also coordinate the needs of the risk managers. So these risk managers, we are talking about people with authority, people who make decisions either to import medical requirements or food commodities. So those are risk managers, they are decision makers. So they define the risk question that need to be answered. Because in most cases, the risk managers or the competent authorities are the ones who initiate the risk assessment process. But also look at their needs and also the ability of the analysts, that's the people undertaking risk assessment. We need to take into account the availability of resources, including the different expertise that are available. And we look at the number of people that may be needed to undertake that project. And what is time do we have? Do we have data and do we have software? So all these need to be taken into account when we are planning to undertake a risk assessment. So here we're talking about you may need a very accurate estimate of a risk, but the resources, for instance, which are available may not warrant you to do such. For instance, you may not have enough time, or you may not have skilled manpower to do such undertaking. So you may need to modify so that this does not suffer loss. In the in the planning phase, communicators also need to be involved in the planning phase to ensure that the strategies for communication are taken into account. They should be there, communicators need to be there from the start of the project. This approach leads to an efficient and effective strategy for managing decision about the risk. So if we plan well, then we are likely to have a good risk assessment project. Let me talk about assessment in general, risk assessment. So risk assessment is the process that develops the estimate of the risk of the likelihood and severity of a particular outcome, given a well-defined scenario. So you have a well-defined scenario. Say, for instance, the scenario could be that we want to import milk from a certain country. And so we are talking about what is the likelihood that if this milk came into the country, people may be exposed to a particular pathogen or contaminant found in that milk. So the scenario needs to be well defined. And so the risk assessment process involves estimating the likelihood or the probability of that event occurring. And if the event occurs, what is the severity of the consequences? So if you put together likelihood estimation and severity, we are talking about, this is what is called risk estimation. So risk in these technical terms is not just about probability, but it incorporates two aspects. That's the likelihood of occurrence and the magnitude of the consequences. Risk analysis is the analysis step in which data are gathered and assessed, and models are chosen or developed, and the results are driven. So we are saying this is the analysis step. It's a step that uses scientific data in order to quantify or estimate the likelihood of occurrence. Risk analysis or assessment can be done on a single page in 10 minutes. I earlier mentioned to you that it all depends on what you want. If you want just a rough estimate of the risk, this can be done on a single page, and in 10 minutes it can be done. But it could also be a lengthy process, which may need you to write 500 pages, and that accompanied by other spreadsheets and models. It can be sophisticated depending upon the requirements as spelled out in the initial phase. Risk assessment, as defined by the National Academy of Science of the US, includes 4 steps. That's hazard identification, hazard characterization, exposure assessment, and risk characterization. Of course, we'll look at other frameworks, such as the OIE, the Codex, and that for PACE risk assessment. So this framework has been adopted by the Codex Alimentarius Commission, which we use in food safety. The other part of risk analysis is risk management. So risk management is the process of making decisions about risk, informed by the results of risk assessment. So once the results have been obtained from the risk assessment, these results are passed on to the risk managers. So the risk assessors, say technocrats, they will do the assessment, and then they will pass over the results to the risk managers who have to manage the risk. So it includes determining whether the risk calculated in the risk assessment is acceptable or unacceptable, given the accompanying level of uncertainty. So the risk managers may have to make judgment of the results of the risk assessment. They may accept the report of the risk assessment, or they may reject it. So they may call it acceptable or not acceptable, depending on the level of uncertainty associated with the estimate. In case of an acceptable risk, or for instance, they say that the risk is unacceptable, it's too high, Because, for instance, if you want to import a product, say from one country into your country, and after estimating the risk, for instance, you find that the risk of occurrence, say for instance, let's say for instance, is 10%. There's 10% chance that people may be exposed to this particular commodity. And then the risk manager may regard that amount of risk as unacceptable. So in that regard, if they consider risk unacceptable, they may suggest development of strategies to reduce the chances of exposure. I heard of a certain country which wanted to import mangoes, for instance, and they were scared of introducing some fly, which tends to burrow inside the mango seed. So after undertaking a risk assessment, they found that the risk or the likelihood of introducing that fly was very high. So in that case, they considered the risk unacceptable. And so what they did is to apply mitigation measures to reduce the risk of exposure. And what they did is to make sure that every mango that it was imported was irradiated. What may happen is that it's not always that when we find the risk to be unacceptable that we may abandon a project or, for instance, a business undertaking. But if we find that the risk is high, we may have to find ways or strategies how we could reduce that risk by suggesting or designing intervention measures. But the other alternative is that the risk managers may also suggest that more research data is collected, especially if they find that the level of uncertainty is very high. So they may commission research so that more data is collected in order to reduce the level of uncertainty, so that they are more sure that what is being presented is a correct situation. The other scenario is that the risk may be acceptable. In the case that I earlier mentioned about, you may find that, say for instance, the risk is 0.5%. And you may want to know that it's almost literally impossible to do transactions in commodities such as food or animals without any amount of risk. There will always be some bit of risk. Even when you have done vigorous testing, a pathogen or contaminant may escape. So we talk about acceptable risk or minimum risk. So the risk managers in that case may involve efforts to ensure that exposure stays or is lowered to a certain level. So you may say, okay, this risk is acceptable, or they may even want to lower it further. The other aspect of the risk assessment framework is risk communication. So risk communication is, in most cases, taken into account as part of risk management. But in certain framework, you see that it's listed as a standalone component of the risk analysis process. Again, the National Research Council for National Academics has described it as an interactive process of exchange of information and opinion among individuals, groups, and institutions. So when you have a threat, for instance, or you want to do a transaction, we are saying that there should be an interactive process of all that are concerned to share information at every stage of the risk assessment process. So it involves multiple messages about the nature of the risk, and there are also other messages not strictly concerned about the risk, but they may express concerns, opinion, or reactions to the risk messages, or to legal and institutional arrangements for risk management. So there could be a nature of the risk, but also others may be interested, for instance, in how the risk assessment is being done, or who is concerned with risk assessment. So there will be all that communication of information. But I want to refer you that to the course that will be also done in this program in that course, the health promotion course, VMM 8911, you'll find they are spelled out effective communication skills message, because there is a way in which you can communicate message related to food safety, and so they are suggested methodologies on how you can communicate health information. Now, I want us now to turn to look at the approaches to risk assessment. Basically, when we talk about the risk assessment, and if you look at the SPS agreement of the WHO, they are concerned with protection of the animal health, human health, and also plant health or the environment. So we'll talk about in this case, they will talk about the animal health, talk about human health in this case, they will talk about food safety, and also talk about the pest control. So basically, there are three frameworks that are recognized internationally with respect to international trade. We have the framework suggested by the World Animal Health Organization, or the OIE, and we have the disease framework, or the health framework. Then you have the model by the Codex Alimentarius Commission, which is the food safety risk assessment framework. And we have the model by the International Plant Protection Convention on risk assessment concerning quarantine pests. So different systems have been developed to answer different types of risk questions. The OIE model is quite versatile, and I said it's the one that is majorly used in investigating risk related to animal health and also human health in terms of disease pathogens. The Codex model is much more focused on food safety in terms of microbiological hazards and also toxicological hazards. Then we have got the model on the pest risk assessment by the International Plant Protection Convention that looks into the risks that are posed by quarantine pests. For instance, at this point in Zambia, we are scared about the armyworms. And so if you are to look at the risk of, say, for instance, if you look at the risk, if, say, for instance, armyworms were just in one province of Zambia, and we want to see or estimate the likelihood of the armyworms going to another province where it is currently not present, then we may have to use the model suggested by the International Protection Convention to see what is the likelihood of these armyworms going to a particular region, and if they were introduced in that area, what is the consequences or the magnitude of the damage that they will cause. So you have to quantify those and then make a decision so that you put proper measures. Then we look at the risk assessment according to the human, that's the food safety risk assessment. So the food safety risk assessment has the following component. This is the OIE framework. So the OIE framework has got the following components: the release assessment, exposure assessment, consequence assessment, and risk estimation. In the release assessment, what we are trying to estimate, we are just interested in mapping the biological pathway for the release of the hazard. For instance, if, say, Zambia want to export livestock to another country, and that country is scared of FMD, so we map the biological pathway on how this FMD could move from Zambia to that particular country. And then we estimate the chance that, say, for instance, cattle that will go to that particular country will have in them the FMD virus. Then you have the exposure assessment. So release assessment is about the pathogen crossing the border of a country. Once the pathogen has crossed the border of the country, then we classify that the pathogen has been released from the territory of its occurrence to the unexposed population. Then we have the exposure assessment. The exposure assessment is basically mapping up the biological pathway to estimate the chance of the humans or animals that are in the receiving population. What is the chance that they will be exposed? So that's what we estimate in the exposure assessment. So here in this step, we look at the occurrence of the susceptible hosts. Are the susceptible hosts present? And if they are present, what are the chances that they will receive or they will be exposed to the particular hazard? That's in exposure assessment. Then look at the consequence assessment. So the consequence assessment measures at what damage will be caused if this pathogen escaped into the new territory where it doesn't exist at the present moment. And these consequences can be economical consequences, or they could be health consequences. So we have to estimate. And now in risk estimation, we put together the 3 steps. That is the probability estimated in the risk assessment and in the exposure assessment, and also look at the consequence assessment. So when these 3 are analyzed together, then we estimate the risk. This is basically what I've been talking about. We have the hazard identification. You have to have a hazard. This comes in the initiation step. With the hazard, in this case, I was talking about FMD. Or it could be other diseases, like now we hear about the threat about the coronavirus, or any other disease that, for instance, is not present in a receiving territory. Then you talk about the risk assessment has got 3 components. We have got the risk assessment, and then you have got the exposure assessment and the consequence assessment. So this put together is what makes the risk assessment. And we say that communication need to be taking place at every stage. And then this information will be passed over to the risk managers. This is the Codex framework suggested by the Codex Alimentarius Commission. And this is the one that is applied in food safety. And the framework involves hazard identification, which is an in-depth review of literature. And then we have hazard characterization, which is based on dose response. How much, say, pathogen or chemical does one need to be exposed to in order to suffer from adverse exposure? So they quantify the dose response. This can be chemicals or the amount of bacteria that one consumes. And then talk about the exposure assessment, that is the likelihood of intaking this pathogen or chemical. So look at the amount of, say for instance, if you are talking about aflatoxin in maize, we're talking about what is the likelihood that somebody will eat aflatoxin in such quantities that could be harmful to the person. So to talk about the likelihood of them eating contaminated maize and also the amount of Mishima that they eat. So those will be considered in the exposure assessment. Then again, we take these 3 above, and then we estimate the risk. Quite close to the one that we saw in the OIE framework, but there are some minor differences, especially when you look at the risk hazard characterization there, when we talk about dose response. And also the way we estimate exposure assessment is slightly different in this case. So this may not be very clear, but it's all just elaborating what I've been talking about hazard identification, hazard characterization, exposure assessment, and risk characterization. Let me now move to the pest risk assessment. So the pest risk assessment, or the analysis itself, is composed of 3 stages. We have the initiation, the pest risk assessment, and risk management. So basically there are 3 suggested steps. But we look at the pest risk assessment, it has got those 5 steps. Talk about pest categorization, assessment of the probability, assessment of the potential economic consequences, and overall assessment of the risk. And then you estimate uncertainty. So this is what is involved in the risk assessment process with respect to pests. Talking about, say, for instance, the fruit fly, as I said, also the armyworms. If you are to estimate that risk, this is the model or the framework that we use. So the results of the risk assessment process then is inputted or given to the risk managers in stage 3. Again, this is just an elaboration of what I'm talking about, the process overview of the risk assessment process. So the upper part is the risk assessment, and the lower part is just trying to put things into perspective, the flow of events in the risk analysis. So you have the risk assessment. At the top there, if you see, we start with the initiation, and then we have got I can see properly, but anyway, you have initiation, then you identify the pathogen and the process as mentioned above there, and then the information comes to risk management, and depending upon the decision of the risk manager, they may say repeat the process, get more data, and redo their assessment. I look at another aspect of the risk assessment. So apart from the 3 types of assessment, one may also opt to do either a qualitative or quantitative risk analysis. So we will look at this in more detail in the subsequent lectures. But the output, because we are talking about the output is the risk and also the uncertainty accompanied with estimate. So the output or the way we estimate risk in this case, it's in qualitative term. That's why we say qualitative risk assessment. So we estimate the risk either to be high, low, or medium. For instance, I just want to give you an example. If, say, for instance, somebody tells you, how is the temperature like? You may say the temperature is high, the temperature is low, or it's medium. So when you give such a response, you're talking in qualitative terms. But when you talk about quantitative estimation of the risk, you talk when somebody asks you, what is the temperature like? You say the temperature is 20 degrees. So you are very explicit in your statement. So these itemized here are the major differences about the way you quantify the risk, whether you use the qualitative framework or the quantitative approach. So we'll look, as I mentioned, that we'll look in more detail on how to do a qualitative assessment and how to undertake a quantitative risk assessment. Let's now just briefly look at the overview of the risk assessment application. So once we have undertaken the risk assessment, the information can be used in so many instances. In the first place, we are talking about scientific data. Scientific data may come from foodborne illnesses and also laboratory studies. So we need this data from laboratories, because the laboratories, for instance, will tell us, for instance, which kind of pathogen is common in a population. We may talk about, say, for instance, it's maybe cholera or salmonellosis or campylobacter. So you get laboratory information, this data from laboratories. And also the laboratories such as the Zambia Bureau of Standards, they also keep information on chemicals. For instance, Zambia Bureau of Standards, they do tests for aflatoxin in maize. So you may need that data from Zambia Bureau of Standards if you want to estimate the likelihood of human exposure to aflatoxins in maize. And then we also have data from other models or predictions. And you have got the data from environmental conditions. And also, if you remember, in the other lecture, we talked about the consumer also. The consumer is an important source of information. So the consumer will give complaints about a particular product, either to the government or to the manufacturer himself. So this information from the consumer also may be inputted into the risk assessment process. So here I'm interested about once the risk has been characterized, what are the possible applications of such information? On this diagram, and I'll come to it in the subsequent slides, I say that this information can be used to prioritize food safety research. Because once you do a risk assessment and you find, for instance, that there is a risk associated with this particular product, then you may prioritize, give money to such a risk so that you reduce it or you find more information. It's also used in development of performance standard. So if, say, for instance, you have a certain application and you want to see whether that application offers minimal or maximum or minimal risk. So if you can risk assessment, use assessment to estimate how that particular standard or certain activity is performing. It's also used in estimating critical control points. Talk about risk estimate. So what is the critical control point? Or which activities do we need to focus on so as to reduce the risk? Because when you do the risk assessment, you may need to do a sensitivity analysis. And when you do a sensitivity analysis, it will give you which factors are contributing much to the risk. And then that could be used to help you to focus your resources so that you reduce the risk. So those points could be called critical control points. But also risk assessment could be used to determine equivalence. This is promoted by the World Trade Organization. Determining equivalence in this case, for instance, if, say, for instance, I want to sell milk to a particular country, and that country says that before I sell milk to them, I must pasteurize it because they are scared of a certain pathogen in the milk. So their control measure is pasteurization. But I may not have the techniques or that equipment to pasteurize. I may tell them that I'm only able to boil the milk. And then if, say, boiling can achieve the same level of protection as pasteurization, then the two measures will be termed to be equivalent. So risk assessment is used in such determination. It may also be used to examine intervention. For instance, let's say, for instance, in this country we have suffered from FMD and foot and mouth disease. And the government puts up certain interventions in order to control the spread of the disease from one area to another. So in that instance, you want to see how effective is this intervention. So you may use risk assessment to evaluate implementation of certain interventions. And I say that it can be used also to evaluate resources. And also allocation of resources. As I said that for a country like ours, which doesn't have enough resources, you want to place resources where you are going to have the most benefit. So if, say, for instance, a particular activity contributes significantly to the occurrence of the risk, then you put resources in controlling that activity that has a proportionally large contribution to the occurrence of the risk. And then also it says that you can evaluate changes in policy implementation. So if you change policy, for instance, the government change policy, may want to see how that change policy is affecting the population, whether it's positive or negative. So these things that I've been discussing here are much more what I listed here also. I says that risk analysis can be applied, establish food safety policies, allocate inspection resources. For instance, when it comes to allocating inspection resources, if you are applying, for instance, if you want to control, to assure people of the safety of the food they eat, you may want to profile, for instance, restaurants. You want to profile restaurants. Which restaurants, for instance, are likely to pose a threat to the public? And it's those restaurants where you may focus your inspections rather than those that have got good hygiene practices. So you do a risk-based control. So it helps in making use of the resources. It also measures government performance in achieving public health goals, and also used to standardize and harmonize assessment methodologies. I've mentioned this, used to evaluate public health benefits associated with the public policy options, and also focuses finite resources on the greatest risks, and also several applications for public health professionals, food safety managers, and the stakeholders. So we're saying that risk analysis gives as many, it can be applied by public health professionals, food safety manager, and many others. So it has got many benefits in helping us. So what have I been talking about? In this lecture, we have reviewed the overarching framework of the risk analysis process. We have also described how risk assessment fits into the risk analysis. We have stated that risk assessment is a process that develops the estimate of the likelihood and the severity of an adverse event occurring, given a particular scenario. We have also discussed on what risk management is and what risk assessment is all about. And you may also want to know that risk assessment are not a one-size-fits-all. Having mentioned that the estimation of the risk and the magnitude of the consequences depend upon the given scenario. So risk assessment is the complexity of the risk assessment depends on the purpose why you are developing such a risk assessment. And risk assessors and risk managers are independent. That's why we say that it's a structured process, but they are not interdependent. They are independent, they are not interdependent. So it's a structured process. Risk profiles are essential for characterizing public health risk for emerging hazards. Now I just want you to take a piece of paper and a pen and then outline the risk analysis framework according to the OIE and IPPC and the Codex. I want you to outline the various steps, particularly so in the assessment, risky assessment stage. How are they similar and how are they different? I was suggested documents that you can contact for further reading. Thank you so much for listening.